Diabetes is a type of chronic metabolic disease which results from conditions like the organ pancreas producing less insulin, or when the body is unable to effectively use the insulin for metabolism. India has an estimated more than 10 crore diabetic patients as of now. And some other studies says that more than 15% of the Indian population could be pre-diabetic. So diabetes, there are two types. It can be type 1 diabetes, where the pancreas is not producing enough insulin, or it can be type 2 diabetes, when the insulin is not being effectively used by the body. Symptoms of type 1 and type 2 diabetes are mostly the same. They include increased frequency of urination, increased thirst, weight loss, vision problems, increased tiredness, etc. Now, some of the complications of diabetes are increased risk of heart diseases, increased risk of cerebral infarcts or strokes. Then people can develop kidney diseases, increased risk of getting infections such as gum infections, infections of private areas, and some people can go into obesity also, which is usually associated with diabetes. These are some of the complications. And sometimes what happens are wounds take a lot of time to settle. There are certain emergency situations associated with diabetes. Some of them are very high blood sugar, where the values can go more than 600 units. Another emergency associated with diabetes can be severe drowsiness, confusions, delusions, etc. All these conditions, if not treated in time, can cause death. So let's talk about how we manage diabetes. Now, diabetes being a metabolic disease, it is associated with lifestyle modifications. Prevention is always better than cure. Hence, people should be really careful if they have a family history of diabetes, and also if they are obese and they have habits like smoking, alcohol intake, etc. Because these are some of the risk factors associated with diabetes. Now, how do we manage diabetes? Medical management can be done by tablets like metformin, or we have even more recent advanced medications which can control diabetes at a very early stage. Also, if diabetes is diagnosed within the past 6 months, then sometimes some people can go also into remission with proper intervention. Then we have insulin therapy for diabetic patients who have low insulin levels. We can provide them with insulin injections of different types. Then we come to surgical management of diabetes, where in type 1 diabetic patients, we can go for pancreas transplant. And in type 2 diabetic cases who are very obese, we can go for something like bariatric surgery. As I said before, prevention is always better than cure, because diabetes till date is not completely curable. If diagnosed within the past 6 months, with adequate intervention, we can put it into remission. Otherwise, it is not curable at all. Thank you.